Hello and welcome to our special broadcast where we talk about all things health. You're watching Health with Sneha. I'm Sneha Mordani. Now today, once again, we're going to talk about the pandemic, the increasing cases in India like in many other parts of the world, and what really is driving the surge. The World Health Organization is extremely clear when it comes to genomic sequencing in India and outside of India, in different parts of the world, that it is Omicron and its lineages and sub-lineages, about 11 of them that are driving the surge. Thankfully, what has been seen is that they're not really different from the parent from Omicron and continue to cause severe infection only in highly comorbid persons. And by and large, it does appear that it is not causing a severe illness or extreme sickness in normal healthy individuals. One of the reasons could also be because of better vaccination numbers, including that in India, which has already started the vaccination in kids above the age of 15. These are important developments given that schools have opened up and transmission and increase in cases was expected. Hospitalizations also in comorbid children was expected, nothing unusual. So if you think that if you open up in a big way and cases will not increase, that's not the case. There was a period of time where we also lowered our guard, but the masks are back in Delhi and fines are back as well. So 500 rupees fine if you're not wearing the mask. Of course, you can continue not wearing the mask if you're traveling alone in a car or even with your family, you need not wear a mask. But by and large, restrictions are back. We'll take you through some of them, but first the numbers. The R value or the reproductive value, which is the rate at which one infected person infects the other, is over 1 in at least 21 states in India, which means that definitely one infected patient is infecting the other patient as well. In 21 states including Delhi, UP, Maharashtra, the R value has climbed above 1, signaling that COVID infection is only going to spread even further. There is a sense that this has become like the normal flu, but it's not the case, is what medical experts have been saying, because long COVID is not better understood, and we're also seeing long COVID in patients. Even those who suffered from the milder Omicron, so to speak, the fifth variant of concern, long COVID continues to be a bit of a problem there, and this virus again continues to surprise and shock us in many different ways. But R value steep climb has been seen in different parts of the country. Well, the government of India has not yet sounded an alarm essentially. Cases have doubled in a week. Hospitalizations, including that of children, has gone up also marginally. It's not like hospitals are flooded. In fact, if a hospital has about 1,000 beds reserved for COVID patients, just about on an average about 4 or 5 of them are occupied. Even ICU beds are not occupied in a way to cause any sense of panic or alarm. In fact, many health experts are saying that you can't really call this the onset of the 4th wave in India, because it's extremely unlikely that Omicron or its subtypes or the subvariants are going to be driving the fourth wave. This appears to be a case of reinfections, because with Omicron we do know that breakthrough infections are fairly high. In fact, a study in Delhi did indicate that breakthrough infections as much as 80%. So there are people who were actually infected in the month of January and are now infected in the month of March as well. And it does appear that it is the 5th variant of concern. However, the advice is clear that the rules remain the same. Vaccines protect everyone from severe infection. Vaccines, they've opened up for children, and there is no reason, if they're available, why should we not go and take it? This is what the government of India essentially says. Remember, Covaxin is being given for kids above the age of 15, and also approvals have come in for other vaccines, though they're yet to be rolled out. Also, we do know that Zycov-D was in fact approved for kids. It's a DNA vaccine. It's the world's first DNA vaccine against COVID-19, but the proper rollout has yet to be seen essentially. Also, there are problems when it comes to the rollout of Sputnik V. We don't see this vaccine's availability very easily. That's a bit of a problem there. Covishield, which is actually the most widely used vaccine in India, is not approved in kids. So currently the vaccine that's being used in India is Covaxin for kids above the age of 15 essentially, and the rollout of that has been fairly effective in spite of the fact that concerns have been raised over its manufacturing process, and that the company here in question, Bharat Biotech, is not manufacturing it in full swing because the demand obviously has plummeted in different parts of the world where it was actually selling this vaccine or even giving it as a part of the WHO's Covovax platform, essentially WHO's platform from where vaccines were given or sold at a marginal rate to less developed countries. Now, talking about the cases once again, Delhi government hospitals have asked all hospitals to be ready. Medical experts have been saying that this is no 2021. We obviously are better prepared, knowing very well that oxygen requirements can go up, ICU bed requirements can go up, and there will not be a repeat of this situation. In that sense, the preparation is there. Also, the central government has flagged off concerns in a handful of states like Kerala, for example, UP, Maharashtra, Delhi, Mizoram in the northeastern part of the country, where the positivity rate has gone up. In fact, the positivity rate has gone up in many districts of the country where more than 10% positivity rate is being recorded in at least 25 to 30 districts is what the data seems to be suggesting. The WHO, remember, says that anything above 5% is reason to be concerned, if not worried. But we need to be on the guard given that cases are expected to go up in the next few days, and we still do have a large number of people who have not taken both the doses of the vaccine. Boosters are here. Those due must go and take their boosters. Those due the second dose and the first dose must go and get the vaccine, is what the government of India says, because by and large, it is the vaccine which is protecting against the severe infection. The vaccine cannot protect against infection. The vaccine's role comes in, or the vaccine's work kicks in only when the person has been infected, to ensure the person is protected from severe infection. That's the work of the vaccine. So then to say that vaccines do not work, hey, I've been vaccinated but I have the infection, is absolutely wrong. It's not scientific. That's all from me for the moment. Watch this space for all news on COVID-19 pandemic and also other developments surrounding health